In this video, we will explain how to use the temperature probes, what it measures, how you should connect it, and how to make sure that you get proper measurements. The temperature probes can be used to measure the skin temperature of the patient continuously. There are two probes so that the temperature can be measured at two locations. The monitor will then also show the temperature difference between the two. Typically you use only one temperature probe. You can connect the probe to the monitor by plugging the probe in the port at the side of the monitor with the matching color. There is an arrow on the probe which has to be on the top. The temperature probe has a flat side and a rounded side. The flat side has to be placed against the skin. For neonates, the recommended place to put the probe is on the abdomen. Place the probe there and secure it with tape. For pediatric and adult patients, it is recommended to put the probe in the armpit. The probe doesn't detect the difference between body and ambient temperature, so make sure that the probe is positioned properly and check when you don't think the reading is accurate. It is recommended to only use continuous monitoring of temperature on patients that don't move a lot or remove probes themselves. When you remove the probe, make sure to clean it with alcohol to make it ready for the next patient.